Hi there, my name's Lisa Howe from Perfect Form Physio, and today we're going to go through two different taping techniques that I like to use for the low back. Now, a lot of people are using various forms of tape and there are a lot of different stretchy tapes. There are two that I use, both are very effective but for very different reasons. So I wanted to explain the differences between these. So we have dynamic tape and we have K-tape, rock tape, kinesio tape. I use both, again, for slightly different reasons. The dynamic tape I use if my client knows what to do but they are not quite strong enough yet. So it actually helps facilitate some of the deeper little stabilizing muscles in their low back while they're actually learning how to train those up to help support the spine so that the big back muscles aren't taking over, like I explained in the back pain video. The K-tape I use if they can't yet switch off their big back muscles. So this is really good if you've been trying to do your exercises but you find the big muscles just keep switching on and you're unable to let them go. So we're going to do the K-tape version first because this is often what I have to do when I first start seeing someone just to get some relief in those big muscles. And this is great if you constantly feel like your back is just aching and the muscles are working too hard. It's not going to fix the problem, however, it will take some of the load out so you're not getting so much pain and you can actually learn how to fire up those deep little stabilizing muscles. That, of course, is something that we like to look at in clinic, and again, in our core stability, our new approach to core stability book explains a lot of the detail about that as well. So with the K-tape, kinesio tape, rock tape, they're all quite similar. It's a much more of a fabric-based tape. What I'm going to get Heidi to do is to bend her knees, place her hands on her thighs and round out the back. We want it to be in as much flexion as possible. I take the tape from the knobbly bit, the PHYSIO down there, and lay it up around to brow strap line but with no stretch. Just come out of there, darling, while I cut the tape. So we want two pieces like that. And I'll chop those just so they're nice and even. Now the important thing with this one is that we lay them on with no stretch. A lot of people like to bring the stretch on with this tape, but that's not how I find it works the best. What we want is to have the muscle on a full stretch, the tape in a relaxed position, and then you'll see when she straightens up, the wrinkling of the tape actually helps offload the fascia or the connective tissue that has been holding a lot of the tension. So darling, just bend your knees again, tuck the tail under. We want to place the tape down. I like attaching both ends at once. So place one on like so, and make sure that the other side is matching. Beautiful. Then I want to make sure that I evenly lay this down, no stretch, just very loose. Just lay it down on the spine. I'm just going to lift up, place it on there. Again, no stretch at all with this tape. I want her to be rounded out as much as she can. Again, a little bit of heat helps activate the glue. Then come up into standing and you'll see the tape wrinkles up. Now this straight away provides some offload to those big muscles that have been working really, really hard. And this is really nice because it allows you to actually do all of your stabilizing exercises without gripping on with the big back muscles. A lot of clients find this really helpful for me to do before we actually start going through the exercises and for moving around during the day so that they don't have so much tension in those big back muscles. If you have any questions about this or you've been struggling with pain in your back, feel free to give us a call and we can help find the customized solution that's best for you.